My name is Lynn Lay. I'm a program officer at the de Beaumont Foundation, and I work on the Made for Health Justice initiative. Made for Health Justice is an acronym, and it stands for Modernized Anti-racist Data Ecosystems, or MADE, for Health Justice. And it's a partnership between the Robert Wood Johnson Foundation and the de Beaumont Foundation. And what we're trying to do is accelerate the creation of community-led and community-governed data ecosystems in order to promote community health. Made for Health Justice is in year 2 of our 3-year initiative with our 4 communities: Baltimore City, Maryland; Pittsburgh, Pennsylvania; Portland, Oregon; and Tucson, Arizona. Made for Health Justice is trying to address the shortcomings of data as we use it today. Data used in public health can often erase entire groups of people or misrepresent people, and a lot of the decisions that we make as a society are based on data. And so if those decisions are made based on faulty data, incomplete data, and non-representative data, the outcomes of those policies also miss the mark. And so the Made for Health Justice initiative is trying to turn that on its head and make data more representative and more inclusive and more targeted towards the actual needs and desires of each community.
So often you see data being used against people instead of for the people. We're working together for the common goal of being able to positively change the way data is collected in the city of Pittsburgh.
Where we find ourselves right now is we don't have access to the information that we have always had access to, or it's being weaponized against people.
We really want to return to a time when Native tribes were the stewards of their own data and use that data to really help ensure that their people thrive in all areas.
The timeliness of Made for Health Justice is increasingly important because the hyper-local, community-led, and community-governed ecosystems can really be informed by the people to ensure that the information is used judiciously.
My great-grandmother was a well-known basket weaver, and in her baskets is data, it's stories. In our dresses we wear, there's meanings to these colors. There's meanings to everything we wear. The shells are our strength. This is our strength. This is data. All these little markings all mean something.
If there is a data ecosystem that does its job and collects good information, it benefits people and communities whose stories are often erased in data. By having a better system that collects better information, it can benefit everybody.
It improves all communities. It improves the well-being of the entire city.
In Made for Health Justice, when we talk about a data ecosystem, we're really referring to a constellation of things that can include the data itself, whether quantitative or qualitative, but it also includes the people around the data, so the people who are collecting the information and analyzing it, but most importantly, the people that the data represents. And an ecosystem also includes partners and institutions that are involved with the collection and handling of information as well.
There is a lot of power in numbers, and the more organizations that we have collectively putting information into this network, the more patterns we can see and the more that we can do.
When you have a diversity of plants supporting each other's growth, you build a stronger garden. And in our data ecosystem, when you have a diversity of information available, you build a stronger Portland.
We've seen the 4 participating communities kind of dream up this data ecosystem based on their needs and experiences and what they want to see for their communities, and then work towards implementation, which is where we're at right now in the initiative.
So in order to make changes in the systems that we don't like, sometimes we might have to go against the grain. Sometimes we might have to do things that are unconventional in order to really make a change.
There are some very concrete things that the MADE communities have done this year that are really showing that this is possible.
What we've been able to do and what's really exciting is we've been able to integrate hundreds and thousands of records of young people's data across all these different spaces. And so instead of feeling like there's these little dots of data that exist, they're now all together telling one story about the experience in the city of Baltimore.
In the city of Pittsburgh, members of the Black Equity Coalition worked with a specific neighborhood in Pittsburgh that has historically had a lot of traffic safety issues and concerns.
One day, a little guy almost got hit right up there by that light post. He was running for his ball. Did the person stop? No, they just zoomed by.
What the Black Equity Coalition did as a part of Made for Health Justice was partner with city folks to inform the community-based conversation.
We was not sure when the speed bumps were gonna come in Larmer, and there is some speed bumps that were put in on Meadow, and that is another major street. That's a win.
So that's just one example of how city and community-based data and information can come together to create tangible change.
We have all the various components of our governance structure up and running. A year ago, that was just an idea. Today, we have individuals that are actually participating in regular discussions around data that are part of that Community Research and Action Committee.
I want members of the community to know that they don't need to be data experts or data specialists to become part of the solution of what we're trying to do. Their lived experiences, their values, and their perspectives so helpful to this project and can really help us elevate that status for our community here.
It's been really exciting to see just how hungry people are for an initiative like this.
As the momentum has picked up, so has people's excitement.
If we invest now, there are better outcomes for our community, for our city, for us as human beings.
We can build these data ecosystems that are led by community needs, that facilitate a society where everybody can be happy and healthy according to their unique circumstances. Because without equitable data systems, we can't have equitable decision making and ultimately healthy communities.